The history of infertility. In the beginning, in vitro fertilization, also called IVF, is a complex series of procedures used to treat fertility or genetic problems and assist with the conception of a child. In 1976, the first IVF with human eggs occurred. In 1978, Louise Brown of the United Kingdom became the first child born through IVF. 3 years later, in 1981, Elizabeth Carr was born in the United States through IVF. Because of the major success of IVF, it became a clinically accepted technique in 1982. In 1983, the first human pregnancy from donated frozen embryos occurred. Before embryo donation, embryo adoption could be considered, scientists first needed to develop a successful process to preserve embryos. A method was developed to freeze, store, and thaw the embryos, also known as cryopreservation. Once cryopreservation was considered to be effective, transfers from frozen embryos were able to be executed successfully. In 1972, scientists were able to successfully freeze, store, thaw, and transfer the first mammal embryos using mice. When cryopreservation efforts began, they required a significant number of tools to complete the process, including large, complicated machines. During the 1980s, scientists were able to simplify the process into one machine. However, this machine still required special attention and precision to successfully freeze and thaw embryos. This process is now referred to as the slow freeze technique. Today, the cryopreservation process is much less complicated and can be executed quickly through vitrification. The vitrification process allows embryos to become frozen and thawed within a matter of seconds versus the minutes it takes while using the slow freeze technique. Currently, the conservative estimate of embryos in storage throughout the United States is 600,000. In IVF, the oocyte, also known as the egg retrieval process, can be expensive, averaging between $10,000 to $12,000 per procedure. This price includes the cost to prepare the woman's body with medications, monitor her cycle, and retrieve the oocytes. The number of embryos that will be needed for a successful IVF treatment is unknown. The patient may need to go through more than one transfer cycle to achieve pregnancy. Therefore, as many eggs as possible are retrieved to prevent the woman from having to undergo subsequent ovarian stimulations. In addition to the unknown number of embryos needed to achieve the first pregnancy, families may decide they would like to have more than one child. Retrieving as many eggs as possible allows for the creation and freezing of extra embryos to be used in the future at a much lower cost. Still have questions? Call us, email us, or visit our website.